Namaskar. Today in the evening we are actually have got together to discuss a very important subject, which is a burning problem or a health issue in most of the population because of eating habits, because of lifestyle. And if I were to say, on the eve of World Diabetic Day, we have stats which states that 589 million adults are living with diabetes worldwide. 7 of 10 are of working age. And if you look at the common perspective or common incidence of disease, it's 3 out of 4 population is affected in diabetes. So that is the impact. More than the impact of just the numbers of people affected, it really affects multi-system organ disease. And that's why for today's panel, I would like to welcome all the panelists, which comprise of Dr. Nisith Mohanty, the Chief Nephrologist of Apollo Hospitals, Dr. Abhaya Sahoo, Senior Consultant and Endocrinologist and Diabetologist with us, Dr. Deepa, Ophthalmologist, Dr. Subhransu Sekhar Jena, who is a Senior Consultant Neurologist, and we have Dr. Debasish Nayak, who is a Cardiovascular Surgeon. So welcoming all of you. I think it's a very important subject which clearly states the kind of spectrum it's carrying on the human body which is affected. It needs a broader perspective in order to understand in what way the disease can really impact lifestyle, also the outcomes, because people come to the hospital with one ailment, but they also carry something which is diabetes and blood pressure. And diabetes is today more harmful if we compare with blood pressure in terms of giving the index of mortality slightly higher, and is also a silent killer when you look at in cardiac cases of heart attack not getting reported on time to the hospital and ending in mortality. So let's have a brief discussion on how do we actually look into the deeper, deeper, so as to actually prevent in the early stages, and also in what way we can control diabetes if one is impacted. So I'd like to start first my discussion with Dr. Nisith Mohanty. And sir, would you kindly brief us on diabetic nephropathy, because nephropathy is really a burning problem, and today we are driving in the hospital in Apollo group with 30 dialysis bed, and patients are coming here with renal failure. Probably one of the causes would be diabetes, and apart from other causes. So kindly share your perspective, how actually this is growing, what kind of precautions one should take in the early stages so that we can prevent into it.
Thank you. Good evening, everybody. So gradually diabetes has become the number one kidney killer, not only in the world, it is in India also, and here also in Odisha it has become the number one kidney killer. So why it is happening? Because the number of diabetic patients are increasing, particularly educated and urban areas. It is also affecting the rural people also gradually, because they are, as Dr. Alok mentioned, that changing lifestyle and diets, these things, so that is, and lack of exercise, that is causing diabetes, and diabetes ultimately causing renal problem. And why it happens? Because the blood sugar, when there is rise in blood sugar, the sugars are deposited in the kidney. Kidney is a filter, and because the filter is affected, so that there is a renal dysfunction that lead to less clearance of the urea creatinine. There are other function of kidney affected. So important thing is that the diabetic kidney disease we actually diagnose with 2 tests, very simple test. The early stage, you can go for a urine protein, that we can do either albumin creatinine ratio or your urine routine microscopy that shows that is albumin. And another simple test which is available most of the places, even now in rural area also that available, that is serum creatinine. From there, these 2 tests we can from early stage actually we can diagnose, because kidney disease is a very silent disease. Unless there is decrease in the kidney function more than 80%, there is no symptoms. Also may not be, your creatinine may be also normal. So that is why the picking of the kidney disease early stage, so that we can prevent the progression of kidney disease and they develop kidney failure, because kidney failure is very expensive treatment. that is a very expensive treatment, because suppose somebody goes for a dialysis, then maybe 40 to 50,000 per month you have to expend, or if you go for a transplant. So as we are a developing country, emerging country, so we cannot afford, even the developed countries, they are finding that it is difficult to manage manage dialysis and kidney transplantation. So the only solution for our country and our state is to detect early and treat early, so that we can prevent progression of kidney disease to end-stage kidney failure. And for that, you have to regularly check your blood sugar, obey your doctor what he has advised, proper diet, exercise, that can delay the progression of the kidney disease. Thank you.
Thank you, Dr. Mohanty. One important point I realize from your narration is 80% of damage which has happened, still the person is having a normal urea and creatinine. I think that's very important to understand, that if one is not undergoing health checkup regularly, at least once annually, or diabetes for the sake at least once in 6 months, you may end up in a stage where kidney damage has happened to a level that you may need a kidney transplant, and that's a very costly, and before the transplant, the dialysis as a process is very cumbersome. So it's not easy, and life is very precious today, and we really have to be very careful in understanding what measures we should be taking, so that disease is preventable in early stages and these kind of damages don't happen. And the next question is, I would ask my colleague Dr. Abhaya Sahoo, you being the brand ambassador of diabetes for the state and for the nation, and this year, every year has a theme and initiative. So kindly brief us something about the theme or initiative of this year, and also what is your perspective, because you handle entirely the diabetes kind of patient and entire spectrum of endocrine disorders, and you have seen the entire bandwidth of diabetes complications. You must be very clear what is the long-term vision of the country like us, which has grown diabetes to this level, so that we can prevent and emerge better in terms of healthy living lifestyle.
Thank you, Dr. Alok. And every year, actually since 1991, this World Diabetic Day is being celebrated in every year November 14th. Why November 14th? Because we are discussing that insulin is one of the drug which actually changes the life of millions and millions of people, and it was first invented by 4 people: Banting, Best, and Collip and MacLeod. So this is the birthday of Banting, Frederick Banting. So this is the reason why actually it is being celebrated throughout the world is World Diabetic Day. And first IDF and then WHO endorsed that, and it is actually was celebrated in November 14th. Every year, usually there is a theme on which actually the whole year regarding the diabetic management we work, whether it might be on type 1 diabetes, it might be on type 2 diabetes, it might be on obesity plus diabetes. But from last 2 years, the theme was diabetes and well-being. So when we are discussing diabetes and well-being, every year we give separate groups for that well-being, and in 2025 it is diabetes and well-being in working population. So what does it mean? This means that in working population, we have already, Dr. Alok has discussed that in the city, if you take all urban population, 7 out of 10 is found to be diabetic. So you can imagine the working place, usually they have a lot of stress and strain. Usually their sleeping hour is less. A lot of time as a hospital, we know that our workers, even if working day and night for the patients. So in those people, the level of stress is very high. There is no adequate sleep. And due to their stress, a lot of the time they forget to take their medicine, and also they forget their own well-being. So the motto is, in the working place, there should be an adequate balance between a healthy lifestyle, good diet, there should be a regular exercise, there should be adequate sleep of at least 7 hours. On top of that, a lot of the time due to stress, addiction is another problem which comes to the working place. That means this smoking, alcohol, that also a lot of the time you find due to stress this working people take. So de-addiction is another important thing, so that at least this de-addiction will help them for a better life and for a prevention of the complications. the most important thing to our workforce is that always consult your doctors, take your medications properly, have a adequate sleep. De-addiction is utmost important. On top of that, regular exercise for 30 to 45 minutes and healthy diabetic diet. That is most important thing, because we know as we are progressing towards a developed country, a lot of the time we are seeing now we are taking a lot of fried food. Nowadays we are taking a lot of pizza, burger, all those things. So that is actually another thing which leads to increase in the diabetes particularly in our population. Regarding the complications, normally if you will see when someone is getting diabetic, 66 to 70% people, they don't have any symptoms. So it is almost, you can tell, 2/3 patients usually asymptomatic. It is usually detected by routine testing. Why routine testing? A lot of the time people tell that my parents are diabetic, so every yearly I do my blood glucose and I got diabetic. A lot of the time people come for some other reason to the hospital. As a routine test, we do blood glucose and blood glucose found to be high. So these are the way how a asymptomatic patient gets. Only 20 to 30% people have actual symptoms. That is also majority time it is vague symptoms, like someone will tell I have some sort of weakness, body ache. Only few people tells I am having hyperphagia, polyuria, polydipsia and excess things. That happens in a very short group of people. Still, these are the symptoms, and also foul smelling breath, and there is some sort of blurring of vision, and also there is some sort of bleeding from the gum. There are few additional symptoms, and some people also complaints like balanoposthitis and vulvovaginitis. That is also another thing which actually makes them come to the hospital and also being detected as diabetic. So these are the few symptoms. Regarding the complications, we have diabetic complications. Of course, any organ in the body can be affected by diabetes, but we classically divide it into microvascular and macrovascular complications. In microvascular complications, three most important thing is retinopathy, nephropathy, neuropathy. These are the three most important microvascular complications. Retinopathy means eye is getting involved, nephropathy means kidney is getting involved, and neuropathy is peripheral nerves are getting affected. And three major macrovascular complications is CAD, PVD and CVA. That means CAD is coronary disease, heart is getting affected. PVD means peripheral vascular disease, so blood supply to both the limbs will come down, so that might be ulcer, that might be amputation. And CVA is actually cerebrovascular accident, so there will be stroke and paralysis. These are the three major events, macrovascular events. Of course, leaving that, a lot of complications from our hair from the head to toe. Everything is getting affected by diabetes. So most important thing is you always consult your doctor, take medication properly, and at least an annual checkup for complications is utmost important to early detect and to take some steps so that we can further prevent the future complications in diabetic related complications. So this is the thing what we can thank you, sir.
Thanks, Dr. Abhay. I think that's very important to understand the way we are actually going in this world with a lot of consumption of fast food is actually a major precursor or an agent which we don't realize until we start reporting in the form of a diabetes. So if we take calculated steps in actually grooming our lifestyle, I should say grooming, why? Because we really don't understand lifestyle unless something happens. And with the way Dr. Abhay has shared that microvascular complications is impacting not just the major organs but the entire body is affected. It's very important to take those steps early rather than being very late in taking those steps. So thanks, Dr. Abhay. My next question is to Dr. Subhransu Sekhar Jena. You rightly mentioned, Dr. Abhay, that neuropathy is one of the complications. And neuropathy is really, we can say it's like something which can actually impact the entire delivery or entire motor system and sensory system. So I would like Dr. Subhransu to share what exactly is the impact of diabetes in neuropathy, because he sees the entire range of patients which comes to his clinic, and let's understand his perspective on this.
सर थैंक यू. तो आमे वर्तमान पर्यंत आमे जानिलु जोटा कि डायबिटीज आमर शरीर रे मुख्य ऑर्गन गुडी को इफेक्ट करे. एवं सेटा आमर नर्भस सिस्टम मध्य एफेक्ट करे। नर्भस सिस्टम एक्चुअली दुई प्रकार निया जाइछि, गोटे सेंट्रल नर्भस सिस्टम एवं गोटे पेरिफेरल नर्भस सिस्टम। तो पेरिफेरल नर्भस सिस्टम जोटा कि रोचे सेटा कि आमर सेंसरी नर्व्स रोचे, मोटर नर्व्स एवं ऑटोनोमिक नर्व्स रोचे। तो ये तीनटा नर्व को आमर डायबिटीज एफेक्ट करि पारे। तो जितेबाला डायबिटीज एफेक्ट करे सेंसरी नर्व रे सेतेबाला कौन हुए, गोटे पॉजिटिव सिम्पटम्स हो पारे एवं गोटे नेगेटिव सिम्पटम्स हो पारे। तो नेगेटिव सिम्पटम्स कौन, इनिशियली आपन को गोड़ बधिरा लागिबा बा गोड़ नम लागिबा बा गोड़ कालुआ लागिबा, सेगुडी को आपनकर प्रथम सिम्पटम स्टार्ट हो पारे। तापरे पॉजिटिव सिम्पटम्स कौन आसीबो, पेन बा बथा, जोड़ा कि जलिला भलिया लागिबा, केतेबेले पिन प्रिक कला भलिया लागिबा, केतेबेले करेंट मारला भलिया लागिबा। आपन जेतेबेले चालुथिबे आपन को लागिबो जेमति कि पादरु चप्पल बाहरी जाउची, पादटी मोर स्पंज उपरे अछि बा पादटी मोर बरफ उपरे अछि, सेई भलिया फीलिंग्स होबो। एते सिवियर पेन हो जे से माने रात्रि सोई परिबे नाही। तो सेगुडी को हमरो सेंसरी सिम्पटम्स रो स्टार्ट हुए। तापरे मोटर सिम्पटम्स रे कोन हुए जे आपनकर वीकनेस आसीबा, गोड़ पतला हे जिबा, गोड़ रे वीकनेस आसीबा, आपन चालिबारे असुविधा हबा, हाथ रे आपनकर फाइनर एक्टिविटी जेमति कि आपन बटन लगेबा बा बोतल रो ढिपी खोलिबा, सेगुडी करे परिवर्तन आसीबा, सेगुडी को देखा दिए। तापरे ऑटोनोमिक सिम्पटम्स आसे, जोड़ी को धरनतु परिस्रा रे आपनकर असुविधा हबा, परिस्रा कपड़ा रे हे जिबा, इरेक्टाइल डिसफंक्शन बा सेक्स करिवारे मध्ये असुविधा हबा, खाद्य खाइला बेले आपनकर बहुत गैस होबा सिम्पटम्स होबा, आपन त उठुचंती आपन मुंड बुले कि पड़ी जिवार सिम्पटम्स होबा, एगुडी को ऑटोनोमिक सिम्पटम्स गुडी को आसे। तो तेणु आमर बहुत गुडी को सिम्पटम्स आसे। आउ तापर जोड़ा कि माइक्रोवास्कुलर सिम्पटम्स जोड़ी को आसे, सेगुडी को धन्यवाद सार जेमती कहले आपनकर ब्रेन स्ट्रोक बा पैरालिसिस जोटा कि हुए, ब्रेन को जदि रक्त प्रभाव रे असुविधा हुए ताहले आपनकर ब्रेन स्ट्रोक मध्य होई पारे। तो तेणु डायबिटिक न्यूरोपैथी बहुत कॉमन, जोटा कि आमे जेतेबेले डायबिटीज डिटेक्ट करा जाए 50% पेशेंट करो तांकर डायबिटिक न्यूरोपैथी थाए एवं ता भितर 50% पेशेंट एक्चुअली सेमानकर कंप्लेन ही न थाए। आमे केवल टेस्ट माध्यम रे ही जानि पारू जे तांकर डायबिटिक न्यूरोपैथी अछि। तो डायबिटिक न्यूरोपैथी रो मेन कॉम्प्लिकेशन कौन रहे, जोटा कि तो पेन बोली सेटा कि आमे कहि सारिछु, किंतु तापरे रहे जेतेबेले आपनर गोड़र सेंसेशन कमी जाए, सेतेबेले आस्ते आस्ते आपन जेतेबेले किछि इंजुरी हुए सेटा आपन जानि पारंतिनी एवं ता द्वारा इंजुरीटा गोटे घा हेकी बहुत बड़ परिमाण रे हुए एवं एम्पुटेशन पर्यंत मध्य कथा जाए, जोटा कि आमर इंडिया रे एम्पुटेशन रो मोस्ट कॉमन कॉज एक्चुअली द डायबिटिक रिलेटेड कॉम्प्लिकेशंस। तो सेटा को प्रिवेंट करिया पई हमको ऑटोनोमिक न्यूरोपैथी बा डायबिटिक रिलेटेड न्यूरोपैथी विषय जानिबाटा निहाती दरकार अछि। तो एटा को केमती आमे प्रिवेंट करि परिबा, जे प्रिवेंट करिवार सबुठो मुख्य ट्रीटमेंट हैला डायबिटीज रो ठीक भाव रे ट्रीटमेंट करिया दरकार, सुगर को ठीक रे कंट्रोल रखिया दरकार अछि। सेकेंड जिंस हैला डायबिटिक रिलेटेड डॉक्टर को सहित बा न्यूरोलॉजिस्ट को सहित कंसल्ट करिके आपनकर न्यूरोपैथी रो ठीक रे ट्रीटमेंट करिया दरकार। गोड़ को सबले सफा रखिया दरकार अछि, उषुम पानी रे राति रे आपण गोड़ सफा रखंतु एवं आपनकर गोटे नरम तौलिया रे सेटा को गोड़ सफा रखंतु एवं गोड़ रे किछि इन्फेक्शन रहउछि कि नाही सेटा निश्चय देखंतु। तो सेगुडी को जदि आपण करूचंती डायबिटिक रिलेटेड न्यूरोपैथी रिलेटेड कॉम्प्लिकेशन को आमे निहाती अवॉइड करि परिबा। धन्यवाद।
Thanks, Dr. Jena, for apprising us on the subject of diabetic neuropathy. I think the range of complications in neurology is not small, because anywhere when anything is impacted, be it motor, be it sensory, or be it autonomic, all would be life-threatening, and it's very difficult to maintain certain states of this disease elements. Now I'll request Dr. Deepa, because sight is very important for everyone, and sight everybody would want to be without specs, and if I talk from the basic, but something like diabetic retinopathy is really very grave when somebody gets to know that retina is impacted, and it can cause various range of diminution of visions and other things. So I'll request Dr. Deepa to kindly share her views. What could be the impact that diabetic retinopathy can deliver on human being, and secondly, what kind of precautions one should take so as to prevent from that?
Thank you, sir. डायबिटीज रो सबुठू एमिति तो आखिरे गुड़ाए कॉम्प्लिकेशंस डायबिटीज जो आसे, जोटा को आमे डायबिटिक आई डिजीज बोली जानू, जो भितर डायबिटिक रेटिनोपैथी होची सबुठू ड्रेडेड कॉम्प्लिकेशन। आउ डायबिटिक रेटिनोपैथी भी गोटे माइक्रोवास्कुलर कॉम्प्लिकेशन ता माने होची एटा जो टाइम रे इफेक्ट करे अर्ली स्टेजेस रे पेशेंट मानकर आदौ किछि सिम्पटम्स न थाए ता माने से देखि पारंती तेणु अवेयरनेस क्रिएट करिबा जे डायबिटीज हेले आखिर कॉम्प्लिकेशन हुए सेटा निहाती दरकार जेहेतु आम पेशेंट मानकर फर्स्ट पॉइंट ऑफ कांटेक्ट फिजिशियन माने ही थांती डायबिटोलॉजिस्ट होंतु मेडिसिन कंसल्टेंट होंतु किंबा जनरल फिजिशियन होंतु पेशेंट मान को एडुकेट करिबा कि डायबिटीज हेले तम आखि उपरे प्रभाव पड़िबार रिस्क अछि तेणु रेगुलर आई चेकअप्स करिबा निहाती दरकार दिस इज वेरी इंपोर्टेंट थिंग टू बी डन तो डायबिटिक रेटिनोपैथी रे हमरो आखिर पछपट परदारे छोट छोट ब्लीडिंग पॉइंट्स किंबा फ्लूइड लीक हे कि पानी जमी जाए जहा जोगु विजन आपनकर कंप्लीटली किंबा परमानेंटली खत्म हो जाए पारे तेणु ताहा आपण एवॉइड करि परिबे ओनली जदि पेशेंट माने अर्ली स्टेज रे स्क्रीनिंग करंती आ जेहेतु पेशेंट मानकर अर्ली कोनोसी सिम्पटम न थाए से जनरली आपनको पाकु आसीबे नाही आज भी पेशेंट्स हम पाकु आसंती 10 इयर्स 12 इयर्स 20 इयर्स रो डायबिटीज नै कि आई चेकअप फर्स्ट टाइम करूथबे आ जेते बेले तांको पचरा हुए से माने आंसर दियंती जे हमकु तो केबे की कहि नांती तो यही अवेयरनेस टा क्रिएट करबा निहाती दरकार कारण डायबिटिक रेटिनोपैथी जदि अर्ली स्टेजेस रे आमे जानू ब्लीडिंग हवा पूर्वरु जदि आमे जानू किछिटा साइन सिम्पटम्स आमे रेटिना रे देखिले ताहा जानी पारू तो ट्रीटमेंट अर्ली हेई पारिबो रेटिना डैमेज हवा पूर्वरु विजन को बंचाई जाई पारिबो तेणु जदि आपणकर हार्ट किडनी लंग्स ब्रेन सबू भल फंक्शन करूची किंतु आखिटी देखा जाउनी से लाइफ रो किछि मीनिंग ही नाही तेणु डायबिटिक स्क्रीनिंग इज अ वेरी इंपोर्टेंट थिंग विच हैज टू बी एडुकेटेड अमंग द जनरल पीपल आ ए अवेयरनेस टा आमे एज फिजिशियंस ही क्रिएट करि पारिबो थैंक यू
Thanks, Dr. Deepa. I think what I am trying to get from most of my clinical colleagues is prevention is the key, and regular checkup is the most important master tool that relies in your hand so as to prevent early, first to detect early and then to prevent the progression of disease. Now, my last question would be to Dr. Debasish. Since Dr. Abhaya touched the subject and shared that peripheral vascular disease has an impact of diabetes. So I would like to understand, we'd like to understand from Dr. Debasish, what kind of incidents exist in the community, those who have got diabetes in getting peripheral vascular disease, and what kind of complications in day-to-day living would happen as in symptomatology, that they would be actually carrying some sort of disability or debility on day-to-day work routine.
डायबिटीज पेशेंट जो मानकर भी 15-20 वर्ष ठू ऊर्ध डायबिटीज अच्छी एंड पर्टिकुलरली वेल कंट्रोल डायबिटीज नहीं जो मानकर हाई डायबिटीज अच्छी अबाउट हाफ ऑफ देम तांकर डायबिटिक फुट बा डायबिटिक पेरिफेरल वास्कुलर डिजीज थी एंड रफली 70% कर कॉर्नरी आर्टरी प्रॉब्लम बाहर द प्रॉब्लम इज कि मेजॉरिटी पेशेंट माने एसिम्टोमेटिक रहिबे एसिम्टोमेटिक अर्थ होची जे तांकर कोनसे प्रकार के कंप्लेन इनिशियल फेज रे बा जेतबेले से डेवलप होची जना पड़िबो नाही मन रखी था जो कॉर्नरी आर्टरी प्रॉब्लम जार बाहर तो तांकर चेस्ट पेन हम ना जदि डायबिटीज अच्छी सो पेरिफेरल वास्कुलर डिजीज रे भी जेहेतु नर्व थोड़ा डैमेज हो जाइए पेरिफेरल वास्कुलर डिजीज है मध्य भी तांकर गोड़ गोड़े पेन हम ना एडवांस है गोटे जिन से नोटिस करेंगे स्किन रे मल्टीपल छोट छोट घा गुड़ा हो जाइए आउटा सहज हिल हो ना बा गोटे गोटे जगार टो गुड़ा कला पड़ जाइए हिल हो ना बा चर्मर हेयर गुड़ाक गोड़र हेयर गुड़ाक से सब मरी जाऊँगी आउ स्किनटा बिल्कुल शाइनी देखा जाऊँगी एड़ा सब लक्षण होची जे आपणकर डायबिटीज पेरिफेरल वास्कुलर पैथीटा डेवलप होती जदि ये जिनसा डेवलप होती आइडियली एटा को रेगुलर कम से कम वर्ष 2 वर्ष थे 3 वर्ष थे डॉपलर टेस्ट अन्य प्रकार टेस्टा करवा कथा द रीजन बीइंग कई मेजॉरिटी पेशेंट माने मिसडायग्नोज होती एज न्यूरोपैथी एंड बी ट्रीटेड एज न्यूरोपैथी आ बहुत लेट स्टेज रे जना पड़े ना से न्यूरोपैथी नुह से वैस्कुलोपैथी बा ओवरलैप भी हो पाए जेटा वैस्कुलोपैथी भी अच्छी और न्यूरोपैथी भी अच्छी तेणुक न्यूरोपैथी जो ट्रीटमेंटा कले वैस्कुलोपैथी कौन सी फायदा हम ना वैस्कुलोपैथी जदि हेइथिबो जदि छोट छोट माइक्रोवेसल्स गुड़ा डैमेज होती मेडिकल मैनेजमेंट ही उत्तम कि छाड़िकी अन्य कौन से सर्जिकल किसी ट्रीटमेंट सेमती किसी ना आम पाखे तो बेटर कंट्रोल ऑफ डायबिटीज एंड टाइट कंट्रोल ऑफ शुगर इज मच मोर इम्पोर्टेंट किंतु जदि मैक्रोवास्कुलरपैथी होती कर्निया आर्टरी प्रॉब्लम होइछि बा पेरिफेरल वास्कुलर जदि ब्लॉकेज जोड़ा अछि जदि 75% रु ऊर्ध्व ब्लॉकेज जोड़ा अछि एंजियोग्राम कले जणा पड़ुछि आजिकल सीटी एंजियोग्राम होउछि बा कन्वेंशनल एंजियोग्राम होउछि जदि 75% रु ऊर्ध्व अछि बा डॉपलर 80% कट ऑफ निया जाय ताठू ऊर्ध्व जदि अछि बा पेशेंट को चलिबा बुलिबार पेन होउछि ताले ता पई सर्जरी टा बेस्ट यूजली एंडोवास्कुलर थेरेपी भी आजिकल बहुत अच्छी स्टेंट गुड़ा लगे हम किंतु डायबिटिक पेशेंट रे स्टेंट लगेबार रिजल्ट्स आर वेरी वेरी बैड लॉन्ग टर्म रिजल्ट्स आर नॉट गुड सो आइडियली जदि आप डायबिटीज अच्छी आप जानी 10-15 वर्ष ऊर्ध्व हो गलानी एंड सुगरटा फ्लक्चुएट भी करुच्ची ताले निजे निजे से सस्पेक्ट करवा कथा है आप डायबिटिक वास्कुलोपैथी थाई पारे आउ ताकू रूटीन डॉपलर करंतु रूटीन डॉपलर जदि किछि बाहरला ताले एंजियोग्राम ताकू करबा पड़ो जदि एंजियोग्राम सिग्निफिकेंट ब्लॉक कुटी अछि ताले ताकू सर्जरी करबा पड़ो सो दैट इज हाउ वी कैन ट्रैप दिस पेशेंट्स.
And thanks, Dr. Nayak. I think each of the specialists or experts have clearly explained what is the way forward, first to detect early and then to control so that complications don't arise. And they're very important, starting from might be looking at very small rise in level of sugar, but in later stages if it is goes uncontrolled, that it leads to various forms of neuropathy, nephropathy or cardiovascular diseases which can be life-threatening. So I think the theme for this year, which says no more and do more for diabetes at work, really works well. And the most important message that I can share on behalf of my clinicians is please focus on early prevention or early detection and stay healthy. That's a most important message for the community because we want community to be healthy. We don't want them to be diseased and coming to the hospital with any form of ailment. So I wish everyone a healthy lifestyle, a lifestyle which is free from any disease. But in case that has to happen, it must be clear that you should get your annual health checkup so that you come to know that whether diabetes is knocking your door, and if so, please approach the experts that are sitting with us for a definitive control of diabetes and prevention of complications. Thank you so much, each one of you, for joining this debate. Thank you for this evening. Thank you so much.